Hello, let's learn about anemia, its definition, classification, clinical features and management. Anemia is defined as a reduction in the hemoglobin concentration of the blood below the normal range for age and sex. This can be due to decreased RBC production, increased RBC destruction, or blood loss. Anemia can be classified based on the mean corpuscular volume, MCV, into microcytic anemia, MCV less than 80 FL, which includes iron deficiency anemia, thalassemias and anemia of chronic disease. Macrocytic anemia, MCV greater than 100 FL, which includes vitamin B1-2 deficiency, folate deficiency, liver disease and hypothyroidism. Normocytic anemia, MCV 80-100 FL, which includes acute blood loss, anemia of chronic disease, hemolytic anemia and aplastic anemia. Clinical features of anemia includes fatigue and weakness, shortness of breath, dizziness or lightheadedness, palpitations, pallor, pale skin and mucous membranes, jaundice in hemolytic anemia, glossitis in vitamin B1-2 deficiency, and neurological symptoms in vitamin B1-2 deficiency. The management of anemia involves treating the underlying cause and may include for iron deficiency anemia, oral or intravenous iron supplementation, and dietary modification to increase iron intake. For vitamin B1-2 or folate deficiency, vitamin B1-2 or folic acid supplements, and dietary changes to include more B1-2 or folate-rich foods. For anemia of chronic disease, treat the underlying chronic condition and erythropoiesis-stimulating agents in some cases. For hemolytic anemia, treat the underlying cause, for example, autoimmune disorders, infections, and blood transfusions, and if severe, give folate supplementation. For aplastic anemia, immunosuppressive therapy and hematopoietic stem cell transplantation. For acute blood loss, hemodynamic stabilization with fluids and blood transfusions plus identify and control the source of bleeding. Regular monitoring and follow-up are essential to ensure the effectiveness of treatment and adjust it as necessary.